Hello, my name is Dr. Eunice Houlihan. I work at Millbrook HealthQuest Primary Care Practice and I'm a family physician. And today we're going to talk about asthma. Asthma is defined as a chronic lung disease that affects the airways of the lungs, that they're called bronchus. These bronchus, they can become inflamed and they can become tightened, so they don't allow the airflow to enter and exit the lungs, causing symptoms such as cough, wheezing, and shortness of breath. Asthma is a very common disease, a chronic lung disease that affects approximately 26 million of Americans. Of them, 6 million are children and 20 million are adults. And it's estimated that 1 in 12 people have asthma. Asthma causes a lot of absenteeism from schools and from work, so it's a serious condition. The cause of asthma is unknown, but there are very different triggers that cause asthma. Asthma usually runs in families and it runs on people who has atopic dermatitis or eczema. It can be triggered by different elements such as allergens. So when it's caused by allergens, it's called allergic asthma. It can be caused by viruses. It can be caused by gases or fumes, and usually it's called occupational asthma. It can be triggered by exercise, and in that case it's called exercise-induced asthma. And also a big trigger of asthma is smoking or secondhand smoking. So the prevention of asthma is most of the time avoiding the triggers of the symptoms of asthma. Besides avoiding these triggers, it's recommended that they get a flu and a pneumonia vaccine to prevent infections that can exacerbate the symptoms of asthma. The symptoms of asthma in most of the cases are manifest by shortness of breath, pressure in the chest, cough, wheezing, and sometimes with little children we notice that they get very quiet, they don't talk. There are different conditions that can mimic asthma, so we have to be alert of those conditions. Some of them can be, especially in children, if they have a foreign body obstruction, that they swallow something and it's causing the wheezing. Different infections can cause symptoms like asthma, like a bronchiolitis, and they don't have asthma at the moment. Reflux, obesity, and in adults there are conditions such as congestive heart failure or COPD that can cause symptoms similar to asthma. When a person has symptoms of asthma, what they usually have to do? Well, they go to the provider or to their emergency room. They may get treated right away, but they need to know if that symptoms that they have is really asthma or is an acute process of another infection. So they need to get a history of how often is these symptoms happening, if there is anything that is triggering them, and there is a special test that is called a spirometry, in which they can give you medication and see if those symptoms of asthma are reversed. Also, your provider may request blood work to rule out other conditions, a check X-ray, and there is a special test called the FeNO test that helps especially with people who has allergies to be sure that the allergies are not the cause of the symptoms of asthma. Your provider will ask you to do the spirometry to see the test, to see how your lung function is, and they will check if you have symptoms every day or every week, if you have nice symptoms, and if you have ever been in the hospital because of these symptoms or being admitted in the hospital because of the asthma. Treatment of asthma, it comes in two ways. The most important one is avoidance of the triggers. So that's what is so important, to get the history and see what is causing the asthma. It's allergies, it's exercise, it's fumes, secondhand smoking, cold air. Medications are targeted depending on how severe your asthma is, how severe your symptoms are. So the first medication, the most common medication prescribed for asthma is what is called an inhaler. So the inhaler is called a bronchodilator. It's a short acting because only lasts few hours in your system. Okay, they come as a devices such as this that is called the inhaler, and they come in liquids that can be put in a nebulizer. That's for rescue medication. That's the medication that is going to help you when you have the symptoms. If your asthma is very common, you may need another medication to prevent the symptoms of asthma. They may come as an inhaler as well, will be a different inhaler, not the same, or they may come as a discus or in other devices. Okay, they have two medications on them. One of them is called the long-acting bronchodilator. That is the medication that is going to open your bronchis, but for longer period of time. So you may need to use it 1 or twice a day. And also may have medication called steroids, called inhaled steroids, because they go directly in your bronchis and take the inflammation that is occurring in your lungs. Those medications help to prevent the crisis of asthma. If you have asthma and you have shortness of breath at the moment, those medications are not going to help to relieve your symptoms. Other medications that are commonly given are coming in pills. Some of them are called leukotriene inhibitors. They are medications that are pills and help especially patients who have asthma triggered by allergies. There are also another ones called methylxanthines. The most common one called theophylline, that is also a pill that is prescribed in severe cases of asthma. There are also some cases that providers can give you steroids, the most common prednisone, but there are pills that are given when you have the acute symptoms of asthma, or they can be given for a few months if your inflammation is severe. And there is also an injection that can be given by allergists called immunomodulators. Those medications are given only to patients who has asthma triggered by allergies, and those injections can be given to people over 12 years old, can be given monthly, bi-monthly, every 3 months, depending how severe your symptoms are. And there is another medication called cromolyn, and this medication can be used in a nebulizer. A lot of the maintenance medication, especially for children, are given in liquids to be used with a nebulizer. That is a special machine that have some tubes attached to it and is used with a mask. And those medications are easier for the children to be used than these devices that I'm showing you now. There's different resources that can be looked at if you want to need more information about asthma. One of them is the American Academy of Allergy, Asthma and Immunology. Another one is the American Academy of Pediatrics, the American Academy of Internal Medicine, American Academy of Family Medicine, and there is a website that I love that is called Kids Health, and that helps the parent a lot to deal with the stress of having children with asthma. Also, as a resource, I'm giving you information about HealthQuest Medical Practice. We have a website and a patient portal in which you can look information about asthma and about providers who can take care of you and your family. We have pulmonologists as well. The most common inhaler that you may have used is this device. Okay, usually comes in two and needs to be placed together. Another one that is common is the same one, but usually it's a little bit bigger. I will explain the difference later. Alright, these are the inhalers that I use for rescue medicine. It's when you have the symptom of asthma to prevent that you continue having the shortness of breath or wheezing. Usually when we check the medication, we have to check first the expiration date. Sometimes it comes in the device or sometimes it comes outside in the pocket. You're gonna check the expiration date and you're gonna check the dose meter. And the dose meter most of the time is located in the bottom, and then let you know how many inhalations you have left. So the first thing that you have to do, you're gonna open the capsule or the inhaler and you're gonna check it 2 or 3 times. Okay, you're gonna take a deep breath and exhale. Put the device in your mouth and press and inhale slowly. You're gonna try to hold the breathing for 10 seconds. If you have a child, 5 seconds is enough, and then you're gonna let the air out. And if you need another inhalation, you have to wait at least a minute. After you finish with that, you have to go and rinse your mouth, gargle, and spit, because you have to be sure that the medication doesn't stay in your mouth. And you can store your device in any place that is dry, no extreme heat, no extreme cold. You cannot let anybody use your inhaler because it can carry viruses. If you want to rinse it, you can take the medication out, rinse it with water, only the plastic area, let it dry, and then use it again. When you use your inhaler, you can use it up to 2 times at once, and then you have to wait at least a minimum of 2 hours to use it again. Depending on the recommendation of your doctor, could be 2 to 6 hours. If you're using a different device that is similar to this one, but this is have a maintenance medication, alright, these usually are a little bit larger, they come in different colors. You can put the name on them, put rescue and put maintenance medication. Usually this one is also 2 inhalations twice a day. Alright, but then the doctor will let you know if you need to use it 1 or twice. Alright, so now we're gonna teach you guys how to use the spacer. Usually this is used to help with people that have problem with coordination of the inhaler and the respiration. Usually children need that between 2 and 8 or 10, depending on their development, and sometimes elderly people also need that, or when they're really so tight that they cannot coordinate the breathing. The device comes like this, and we have to do the same thing. We check the expiration date, check how many inhalations you have, and you're gonna plug the part of the inhaler and put it in a hole that is gonna have the spacer. Before you put it on, you're gonna have to check it 2 or 3 times. You put it together, and then you take this part, and this is the part that is gonna go in the mouth, in the patient mouth. So if that is your child, you're gonna make them take a deep breath and exhale, okay? And then you tilt the head a little up, and then you put the device in their mouth, and then you press and go, let them breathe slowly for 10 seconds, and then let it breathe out. The same thing, you have to wait a minute before giving another one and do it again. If that's a person that can do it themselves, they don't have to tilt the head, but we want to be sure that the medication goes directly to the lungs and don't stay in the tongue. And after they have done that, they have to again go and rinse the mouth, gargle, and spit. And there is other devices like the discus, which has been in the market for a long time. So the discus is usually used 1 time twice a day. You have to push the disc to one side, click the button, and inhale the medication. And then if you're gonna use this new device that is similar, it's a maintenance medication, you also have to open it, inhale, and close it. That will be once a day. And always after you use your inhalers, please rinse your mouth, gargle, and spit, because you want to be sure that the medication doesn't stay in your tongue.